Good afternoon, everyone in the East. Good morning for those of you in the West. Thank you for joining us here today for the webinar for urologists and staff of urology practices. My name is Michele Blanshard, head up the Genie Solutions division, now part of the Magentis company, and we're excited to have you here today and look forward to sharing lots of information with you. I'd like to begin by acknowledging the traditional custodians of the land on which we meet virtually today. For me here in Brisbane, that's the Turrbal people and the Yuggera people, and I'd like to pay my respects to elders past, present and emerging. So today you'll also be hearing from Niamh Tobin. Niamh's our Director of Product Strategy and Design, and Niamh will be taking you through both our Genie and Gen 2 roadmaps. Why we're covering both products here today is that there are users of both products on this webinar, but also we're aware that there's lots of Genie practices that are curious about where Gen 2's at. So that's the purpose of us sharing the Gen 2 roadmap with you today. We'll also be hearing then from Sean. Sean is our customer education specialist and has many years experience with both Genie and Gen 2, and will be sharing tips and tricks for you to get more out of your software. Down the bottom of the screen, you'll see a Q&A button. Please feel free to type questions throughout the webinar in there. If we can, we'll answer them live as we go through the webinar back in the chat, but then we'll also be answering some questions verbally live at the end as well. If there are things that we can't answer during this session, we will come back to you via email with the answers to those questions. Also at the end, when the webinar finishes, we just stay on for about 30 seconds and answer a quick survey for us. We do want to ensure that we're hitting the mark with our messaging to you and our content, so your feedback is really important. So I'd like to also say thank you to you for your customer support and loyalty to us, particularly over the last 2 years, as we've been very bogged down on compliance work. There are pieces of work that are important to you as users, important to the government as they are the government initiatives, and things like Medicare Web Services, active ingredient prescribing, EPrescribing, MyHR, the immunisation registry, just to name a few. They all seem to come at us at once, and then coupled with, for those of you that are Genie Mac users, and the much awaited 64-bit upgrade, which took far, far longer than we ever envisaged it would. Fortunately, now we've finished the final pieces of compliance work, having EPrescribing out in both Genie and Gen 2. And now, for the first time in about 2 years, our development teams can be pointed in the direction of building features and functionality that you, our customers, have asked for and want. And that's the roadmap that you'll hear about from Niamh today. And so you also should have received an email about a month ago alerting you to a name change. So about 18 months ago, 18 months ago now, we were acquired by a new private equity group called PEP, Private Equity Partners. And so they are now the owners of Genie Solutions. They also own a number of different health technology entities. And it's now that they've brought the three big health technology companies together under one Magentis banner. So whilst Genie Solutions still runs and functions independently, we're one of three divisions across Australia and the UK. Coming together as one will enable us to uncover opportunities for synergies and leveraging each other's technology, and hopefully, as we aim towards an interoperable world, ways of getting connected more and improving that information flow across our software and also across the broader ecosystem. So just very high level, Agentis plays heavily in pathology and radiology systems in particular in Australia and the UK. They're also the owner of Charm, which is an oncology product. So in our ecosystem there, we have the opportunity to make the flow of information far better for you in the future. So now I'm going to hand over to Niamh, and Niamh's going to take you through both the Gen 2 and the Genie roadmaps. Thanks.
Hi, everyone. My name is Niamh Tobin, and I am the Director of Product Strategy and Design here at Genie. As Michele mentioned today, I want to share with you what is happening on our product roadmap. But before I do that, I want to spend a minute or two just talking about our platform vision, as this is how we see ourselves helping you medical professionals deliver better health outcomes in the coming years. Our practice management systems division is really centered around this common technology platform. This foundational technology platform is important because it's what's going to enable us to provide you with ongoing product innovations into the future. Some of these innovations we will develop ourselves, but others will be developed by third-party products that we will enable to integrate into Genie and Gen 2. These new product offerings will be focused on 3 key objectives. The first one is improving the patient experience by providing tools to automate the patient journey. Secondly, focusing on how we can connect up what is a very disconnected ecosystem today and ensure that you have the data that you need at the point of care with the patient to make the right care decisions. And the third area is bringing data-driven insights into your workflow. This is about things like clinical decision support, workflow assistance, and also insights on how you can improve your practice's performance. We've been working on this vision for a number of years now, and we're making good progress. Patient forms, patient payments, specialist bookings have been products that have focused on automating the patient journey. And voice and insights, products that we've released in the last 6 months, are the first set of products that involve partners connecting on our FHIR API. But all of this really only becomes a reality alongside Genie and Gen 2, our core practice management system products. And so the updates I provide today will be centered around what you can expect to change within those coming products. I'm going to start with Gen 2, our cloud practice management system first, and then following that with Genie. So for many Genie customers on the call today, we know that over 50% of you are interested in moving to the cloud. We understand the challenges and costs of running hardware locally, and we appreciate that Gen 2 will give you the flexible access that you need to run your busy practice. This is why we are stepping up a gear and doubling down on getting Gen 2 ready for your practice. And so to do that, we have made the decision to double the number of teams working on core Gen 2 experiences. In addition to improving the core workflows in Gen 2, we're also going to be developing a mobile app. There are several hundred practices, Gen 2 practices using the mobile app today, but we want to make it available to everyone. And we also want you to be able to take actions within that app. We now also have a dedicated team working on the process of moving your data from Genie to Gen 2. And we're accelerating progress on the Genie Solutions Marketplace. So this means that you'll be able to connect third-party products like transcriptions or online booking tools into Gen 2 as well. And so today I am excited to share a general update on how Gen 2 is growing, but then also share the roadmaps for both Gen 2 and Genie. The great news is that with your support, Gen 2 is doing really well. As we look at the number of practices that have already moved to the cloud, we know that over 40% of specialist practices in Australia have already made the move. And of those that have moved, more than 50% of them are using Gen 2. So this means that Gen 2 is the fastest growing cloud practice management system available in Australia, and currently has over 1,500 practices using this. This means that Gen 2 practices are supporting the care of more than 10 million patients and have provided more than 28 million appointments. And as you'll see in the bottom left, 2.7 billion in health services. We have a really diverse group of specialties using Gen 2. About 60% are procedural specialists, and 40% are non-procedural groups like psychiatry and pediatrics. Interestingly, as we look at urology practices as a whole across Genie Solutions, 27% of Genie Solutions practices are now using Gen 2. Some of these will have started on Gen 2 from the outset, and some will have migrated from Genie to Gen 2. What we do see is that the majority of Gen 2 practices today are still single practitioner practices. We do have quite a number of small multi-practitioner practices, but you'll see that the numbers do become quite decrease as we get into the large practice sizes. A question we often get asked from Genie practices is Gen 2 suitable for my practice, or when is the right time for me to make the move from Genie to Gen 2? So we thought it would be helpful to kind of unpack who has already made the move successfully. If we look at those practices that have moved, we see again that there is a really broad range of specialties. Orthopedics, obstetrics, general surgery, and psychiatry account for some of the largest groups of specialties that have moved. 18 months ago, when we looked at the size of practices that were migrating from Genie to Gen 2, it was also primarily single practitioners, as we saw on the previous slide. But looking at this chart on the right-hand side now, you'll see that actually a significant number of 2 to 3 practitioner practices have moved from Genie to Gen 2, and quite a number of practices that have moved from Genie to Gen 2 have been in practice for more than 10 years. We therefore find that, answering the question of when is the right time for me to move, it's less about your specialty or your practice size and more about the breadth and the depth of functionality that you're currently using in Genie. So if you are interested in moving to the cloud and you want to learn more about Gen 2, what we are going to do is host some group demonstrations of the product. So we really are encouraging people to come along to those sessions and have a chat with the team about when the right time for your practice might be to move. But to get ready for Genie customers to move and to improve the experience for existing Gen 2 customers, we really have been listening to feedback on what needs to change. Over the years, we've built quite a rigorous voice of customer system, which is centered around capturing feedback from every interaction our team have with you. This can be calls that you make with support, when you interact with a trainer that comes out on site, or when you've given direct feedback about a change that you'd like to see within our products. This feedback repository has over 2,500 pieces of feedback, and we regularly review this to understand what is most important for us to focus on. If you're watching this and think, I have feedback that I haven't shared recently, but I would really like to share and see actioned, then there's going to be a new opportunity for you to provide this in the coming days. We'll be sending out a customer survey very soon, and it will ask about your experience in Genie and Gen 2 today. And we really are keen to hear your feedback on what you want to see change. This is going to be run by an organization called Gundabluey. So they're an independent group to Genie Solutions. And there'll be 2 emails that will come out later this week, one from Gundabluey, introducing Gundabluey, and then a second, which will actually be a link to the survey. It takes about, just realized the slide didn't click forward. It takes about 15 minutes to complete the survey, but we really would appreciate you taking the time to share that feedback with us. If we look at the feedback that we have received so far about Gen 2, the areas that it's highlighting are things like outgoing correspondence and templates across SMS, invoicing, and quotes as key areas for improvements. It's also identified that you want us to improve a number of key workflows that support consulting with patients. So if we take a look at the Gen 2 roadmap for the last couple of months, and as we head into the next period of time, you'll see how this feedback has informed what we've been working on. A key focus area for Gen 2 has been on improving the consulting with patients workflow. This included a switch over to MIMS for medicines data, and then also enabling EPrescribing. We also recently launched a voice dictation product in our mobile app, and the teams have now turned their attention to improvements in outgoing correspondence and SMS. 2 weeks ago, we released EPrescribing or not 2 weeks ago, in May, we released EPrescribing in Gen 2 with MIMS as our medicines database partner and ERX as our partner for script exchange. We know many practices have been waiting some time for this. Now, there are a number of steps that you need to follow to be able to activate EPrescribing. These can all be found on our knowledge base. They involve steps with PRODA, with MIMS, and with ERX. So if you have been waiting for that capability to be available, please have a look at our knowledge base and get underway with those steps so that you can get EPrescribing active and in use in your practice. Voice is a very exciting new product available via the Gen 2 mobile app. It's powered by Nuance voice-to-text technology and aims to support practitioners spend less time on clinical documentation. We have hundreds of practitioners now using voice, and we really can see significant improvements with practitioners dictating much closer to the time of the patient's appointments. And this is reducing the time that the practitioners are having to spend on dictation and clinical documentation, but also reducing the time that it takes to complete a letter and get that sent back out to the referring doctor. We are continuing to improve this product, and some of the recent improvements include seeing who I've dictated for and voice commands that allow you to populate in things like the patient's name or their date of birth into the dictation as you're from the patient's record into the dictation as you go. Right now, though, the teams have turned their attention to SMS and outgoing correspondence. For existing Gen 2 users, you'll have started to see those changes flow through in the last couple of weeks. One of the changes that was made recently was the ability to create multiple SMS templates and to use these templates for sending of ad hoc or bulk SMS messaging. So our team has just activated, I guess, some filters within the patient list that allow people to filter the patient list so that you can identify patients on a certain day or identify patients who don't have a valid referral, as an example, and be able to communicate with them about their appointment. We are going to see further improvements to SMS and, I guess, around the positioning of patient communications roll out over the coming weeks and months. This includes additional workflows for things such as appointment confirmations, recalls, and actions that you take pre and post consultation. So if you wanted to SMS a patient about a pathology result would be an example there. So there's going to be lots happening in that space over the coming months. Improving the letter writer experience is our top priority at the moment, and it's where 3 of our teams are working on this area right now. There's lots to improve here, including improvements to letterheads, templates, and increasing the breadth of the letter references that are available within the letter writer. We also want to build out the capability to use macros or auto text in letters. These are currently available in the consultations area. But soon they'll be available across consultations and the letter writer. We also know that a large number of practices use secure messaging tools like HealthLink, Argus, Medical Objects to send letters to referring doctors or other healthcare team members. And so we're going to be enabling the ability to attach a document, so a result as an example, to a letter that's sent electronically. And then finally, in this area, we will be building out the correspondence workflows to allow practices to email letters directly to patients. So right now, it allows you to create a letter for a patient, but the only option is to print that out. So you'll be able to email it directly to patients securely soon. So that's what the team is focused on right now. Then the next couple of things on our roadmap will be, the first one is releasing the mobile app for all Gen 2 practices. As I mentioned, we have a couple of hundred practices using it at the moment, but we want it to be available to all practitioners. And we also want to allow you to take actions on the go. So this includes things such as the ability to add consultation notes, the ability to create or action tasks or to-dos within Gen 2, and also upload and annotate images from the app. Alongside this, the teams are going to be looking at the incoming documents workflow. Currently, to add scanned documents to a patient record, these need to be done individually on a per patient basis. So what we want to do is create a workflow that's very similar to Genie, the process folder type idea, where all of the documents come into a centralized folder. And from there, you can triage them, mark them as needing to be reviewed by a certain practitioner or filed away in a patient's record. There are also a number of improvements that will occur to the clinical area in Gen 2. This will be starting with how the screen is laid out, but also how you search for and find information, and then how you take actions pre and post consultation. A key area of focus is going to be procedures, and in particular procedure templates, or the concept, I guess, of procedure templates in Genie, which really should make the documentation and capturing of procedure notes far more efficient. And then finally, we have some new functionality in the early stages of testing with some key industry partners, with Sonic Healthcare, who are Sullivan and Nicolaides, Douglas Hanley Moyer, Melbourne Pathology, or Clinipath, depending upon what state you're located in. We have developed an e-ordering solution for pathology. The first set of customers will start using this in Queensland very shortly, and then it will be rolled out nationally. In May, we also went live with a pilot for our first e-bookings workflow. Here we have partnered with a very large private hospital provider to take procedure booking information from Genie and Gen 2 straight to the hospital booking team. So this is removing the need for staff to send theatre lists each time that there is a change. And then last but not least, we're really conscious that many practices are using other products in their practice that don't currently integrate with the PMS. So this could be things like booking products, transcription tools, telehealth, or just general patient engagement tools. So over the coming months, we're going to be building the foundations that's needed for practices to be able to connect these products into our core practice management system workflows. So as you can see, there's lots happening to build on Gen 2's capability. I'm really confident that it's going to make the experience much better for existing Gen 2 users, and also really move us towards getting ready for many more Genie customers to migrate across successfully. We really do appreciate, as Michele mentioned, that feature development has been slow in Gen 2 for some time. So we're really looking forward to sharing more updates with you on progress through Gen 2 over the next few months. Now, I know many of you on the call will be Genie customers, and while you're interested in how we're improving Gen 2, you'll also be interested in what's going to be happening in Genie. And while we are investing more than ever in Gen 2, we will continue to add new functionality and address your feedback, the feedback that you have provided us for Genie as well. If we take a look at the feedback that we've received for Genie, the top areas of concern are consulting with patients. And specifically, this was around e-prescribing and also ordering of diagnostic tests. We've also received lots of feedback around how you would want to improve the patient forms workflow. And then a significant number of requests for improvements to SMS templates and just your ability to communicate with patients. And so if we take a look at the roadmap for Genie, I think, again, you'll see how this feedback has influenced what's on the roadmap. Recently for Genie, our focus has been 64-bit, as Michele mentioned, and also the initial release of ePrescribing. In April, we also launched a product called Insights. Right now, though, we are focused on ePrescribing improvements, bringing native word capability back into version 10. And then further improvements in the consultation workflows. So that's primarily focused around real-time prescription monitoring. So to talk about each of those in a little bit more detail, I'll start with Insights. So Insights is a product we developed with Cubico. It's a practice intelligence platform which analyzes your appointment and financial data to help you better understand where referrals are coming from and how the practice is performing. We have a number of practices now using this, and their feedback is that Insights is saving them hours each week on building reports and understanding what's happening within the practice. And it's already helped them identify opportunities for both process improvements and also business performance and business expansion opportunities. Genie version 10 is our release of the 64-bit version of Genie. So we released this late last year, the first version released late last year. And since then, over 30% of practices have upgraded to version 10. Since this upgrade, we have seen that a very small number of practices have experienced some performance issues. And so right now our focus is on addressing these and releasing the next version of Genie, which is 10.2.1, which contains some performance improvements, brings back the capability of native Word, as I mentioned, and also previewing Word documents within Genie, and then also will support the import and export of Word documents through Genie as well. We're expecting that version will be available this week, and maybe even as early as later today. Since launching EPrescribing, we are seeing practices send in excess of over 40,000 scripts each month. So it's really great to see so many practices adopt this and get so much value from the work. We have, however, received feedback that practices want more flexibility to be able to modify things like quantities and repeats authorities when they're sending medicines via e-prescriptions. So we have actioned this feedback, and together with the improvements for Word and performance, these enhancements to the e-prescription workflows will also be available as part of that version 10.2.1. Following 10.2.1, though, our attention is going to turn to real-time prescription monitoring. Currently, many practices might be using products external to Genie called SafeScript, to allow them to monitor the prescription and use of controlled medicines for patients. This next set of improvements is going to bring those workflows for real-time prescription monitoring into the prescribing workflow within Genie. Your feedback also highlighted that you would like some improvements on how you communicate with patients. So this is what we will be working on following real-time prescription monitoring. We're going to be building on the existing SMS capability in Genie to enable practices to send appointment reminders per appointment type. So if you want to send a different message for a new patient versus a review patient, but also to be able to send multiple appointment reminders for a specific appointment. So as an example, remind a patient a week out or a day prior to their appointment. And then last but not least, in patient communications, we'll be providing the ability for practices to have a dedicated phone number that patients receive the SMS from. So given the volume of spam messages that are out there today, we know this is important to give patients confidence that the communications they are receiving are actually coming from your practice. And then in the second half of the year, we will be enabling what's called online eligibility checking in Genie. So currently, it's not possible to check the level of cover a patient has with their health fund within Genie. We know that many of you are spending hours on the phone to health funds to understand if a patient is eligible for a procedure, or procedures are being cancelled at the last minute. This is actually our second most from a voice of customer perspective, and so we are going to be bringing that workflow to understand the patient's eligibility into the procedure booking workflow within Genie. And then finally for Genie, very similar to Gen 2, we will have the new workflows for e-orders and e-bookings available in the coming months. These new features will be available as part of the base subscription that you pay for Genie, but they are only going to be available from version 10.2 and onwards. So if there are people on this call that haven't yet upgraded to version 10 or are on maybe the earlier versions of version 10, please start having a conversation with your IT person about upgrading to version 10.2 and later once that is available this week. And so, look, thank you everyone for your feedback. We really do appreciate you taking the time to share with us what you would like to see changed across both Genie and Gen 2. It's incredibly valuable for us to understand what's important to you. And I hope you can see that it really does inform what we are working on our roadmap. I'm going to hand over to Sean now, who will talk to you about some tips and tricks for urologists, and that will be across both Genie and Gen 2.
Thank you, Niamh. For those who have yet to meet me, my name is Sean Nolan, and I'm the Customer Education Specialist here at Genie Solutions. I have over 10 years experience in training both Genie and Gen 2 customers, and I wanted to present some tips and tricks that I've found useful for urologists. I will be covering functions in both Genie and Gen 2. For this presentation, I'll be starting with Genie. So the first tool I like to show for urologists using Genie are what we call procedure templates. The idea behind a procedure template is when you do a specific procedure, Genie can automatically bring in the name of the procedure, item numbers that are associated with that procedure, pre-operation notes, and your your procedure notes being the findings, technique, and post-op fields. So I'm going to show you how you can use a procedure template in your practice. So to create a procedure template, we first select a patient and we go to the green person icon. Just showing you that you can type a procedure into the procedure name field and choose add to menu. The nice thing about doing this is it means that if you ever book in a procedure without using the template, you can just go to the procedure record and you're going to see I'm going to remove the procedure name. I now have a list of procedures I can book in. So that's useful if you're the type of practice that keeps typing in the procedure name. When it comes to procedure templates as well, there are other things you can bring in automatically each time you do this procedure, including pre-op and post-op diagnoses. If you use the indication field, if you type pre-op notes in. In the quotes tab, if you use the same item number every single time you do a certain procedure, you should bring it into the template as well. In the op notes tab, if you do the same findings, technique, and post-op for this particular procedure, you should bring it into the template as well. I'm going to click Save Template, give it a name, and click OK. Next, I'm going to show you how we use a procedure template. So I'm going to be booking in a brand new procedure for a patient. I go to my procedure icon, and this time I click on the Load Template button at the bottom. Here are all my procedure templates. I choose Open, and you can see those items I identified when I save the template have come across into my procedure template in this instance. A question I often get asked about procedure templates is, what happens if I'm doing a procedure and when I'm doing my notes, I might change a word, I might change a measurement, I might make a very small alteration. How do I do that with procedure templates? My advice for those practices is to put the procedure template with as much information that remains the same between patients. When you use that template, if you need to change a measurement, change a word, maybe add in an extra item number, you just do that after you load the template. So use procedure templates for 99% of your information and make that 1% change should you need to. Another tool built into Genie that we find saves surgeons a lot of time are what we call custom forms. It's designed to reduce the need to handwrite any paper-based forms. Commonly for urologist practices, we find that these might be hospital admission and consent forms. But really, this is for any forms that you fill out by hand or maybe by typing into a PDF. You can load it into Genie and that'll save you time. I'm going to show you how you can download forms from our service through the special menu. If you have your own form that is not there in the special menu, you can go to our knowledge base, and from our knowledge base, you can have a look to see how to bring in your own PDF into the form. So to download from our servers, we first click the special menu at the top. Then we choose software updates. We go to the Forms tab on the right-hand side. In this form tab, there are different categories. For instance, in admission forms, we have many hospitals' admission forms listed here. If I go to the section for consent forms, again, we have many consent forms. To download a form, we tick it on the right, and we choose Import One Item at the bottom. We choose Save, and this brings that form directly into Genie. Now, there are other forms available in this window as well, so I do recommend looking here to see if the form you want to use is there. If you want to use the form, we select the patient, and in the Merged Letters screen, we double-click on the form that we wish to open. Here you can see that we have a hospital consent form with procedure information and patient demographic information pre-filled. From here, if you were to click the printer at the top left, this will print out, meaning that this will save you a significant amount of time when it comes to using it for your patients. One call out I want to make is the tick box at the top that says Save Copy and Clinical Record. If you have this box ticked, when you print it out, it will also save a copy in the clinical file of the patient. So if you find that you might be in the situation where you want to reprint this form or just have a copy of this form saved on record, I recommend making sure Save Copy and Clinical Record is ticked so you have that copy available should you need it. Now, the next tool I'm going to be demonstrating are what we call quick scripts. These are designed for your most common medications, and you might have the same dose, frequency, and instructions, or maybe a common medication, and there might be two versions of dose, frequency, and instructions. By adding it to a quick script, this will significantly save you the amount of time that you are typing in a medication name, because with 2 or 3 clicks of a mouse, the prescription has already been generated, possibly as a paper copy or as an e-prescribing script. So quick scripts, if you have already got them set up, they're available in the prescribing area in the quick script drop-down menu over here. If we want to add a quick prescription to the quick script menu, we click the plus button and we search for the medication we wish to use. So for instance, I'm going to be searching for fluconazole. After typing in the medication name, I find and I double click on the variant I wish to use. I put in the dose, the frequency, and any relevant instructions to do with this combination. Now I'm going to click on Add to Quick Script. Nothing comes up. That is quite normal. If I cancel out of this window and I click on that Quick Script drop-down menu, you can see fluconazole has been added to the menu. To use it for any patient in the future, I just click on it and it will appear for that patient, ready to be printed or e-prescribed. If you want to delete something from the Quick Script drop-down menu, you first click on the menu. If you're on a Windows computer, you hold down the Alt key. If you're on a Mac, you hold down the Option key. Whilst you're holding down the key, you click once on the one you wish to delete. Let go of the key after. I click that drop-down menu again. You can see that that has deleted my quick script. So in my experience, when it comes to urologists, there often are a handful of medications that are done quite frequently. I recommend adding them to your quick script list to really bring about efficiencies in your prescribing. Next, I'm going to be focusing on tips in Gen 2. The first tip I want to show for our Gen 2 customers are what we call pathology sets. It's the idea behind a pathology set. It is where you're doing a pathology request and you're looking for a certain condition or a group. So for instance, it might be that patient has got a certain condition and there are 5 different tests that you're doing as part of this condition. Rather than having to search for each individual test, you can save it as a pathology set. And that means that 1, it is quicker, but 2, it is more accurate in terms of your data entry, because there is the scope that if you do 5 tests as part of the set, you might by accident forget to put 1 in. So it's a more accurate record if you save it as a pathology set. For pathology set, if we choose Add, Request, here I'm just going to be choosing my pathology lab. Next, I search for each individual test I want to make as part of this set. So for instance, I'm searching for FBCs, electrolytes, LFTs, and ESLs. Next, I click Create Set, and I put in what I call this combination, for instance, standard screen. Tick. Now you can see standard screen appears in my list. If I want to use a set in the future, I just search for my set name, and that comes up. There is nothing stopping you adding an additional test in addition to the set that you're using. So pathology sets will save you a lot of time when you're requesting pathology. You can take a photo in Gen 2 using your mobile phone. The advantage of this is the photo does not belong on your phone and it gets uploaded directly into Gen 2. There are many use cases that we have available for this. For instance, you might be doing inpatient rounds and you want to take a photo of the hospital demographic information. You might be seeing a patient in consultation and you need to take a photo of something. There's a lot of advantages why you'd be taking a photo from your phone, and the photo does not belong on your phone. It just gets uploaded directly into Gen 2. So if this is something that you wish to use, you need to make sure you go to the website for Gen 2 on your phone and go to the appointment diary. Apologies, that skipped forward a slide. I'm just going to go back. We choose the patient that we wish to take a photo of. We choose the add menu at the top, attachment, choose file, take a photo or video. This activates the camera on your phone. You take the photo that you wish to use, then you choose use photo. You can rename this should you need to, and choose a category. Now, depending which category you choose, it will come up in the relevant tab of that patient's clinical file. So here I'm choosing procedure, for instance. It'll appear in the procedure section right next to my procedure record. Now, just like taking a photo on your mobile phone, you can also categorize any existing attachments you have in Gen 2. To do this, we click the same add menu like from a mobile phone and we choose attachment. When I click choose file, this allows me to upload an attachment from my computer. For instance, I'm going to choose this PDF document and this picture. I'm going to change the display name of the PDF document to be a letter from the GP. And I get to change the category, in this instance, as correspondence. The nice thing behind that is that it will then come up in the letters section. I can also choose consult note to appear in my consult note section. Diagnostic report for any pathology and radiology. That correspondence section I was talking about, alongside your procedure notes. And if you deal in pregnancy records, you can choose pregnancy. This one is clearly a letter, so I'm going to choose correspondence. Next, I'm going to be changing my file name, my second item. This is clearly a diagnostic report, so I'm going to choose diagnostic report. When I go upload, you can see that my letter appears with the page icon. If I go to my results section, you can see that my picture is alongside an electronic result. If you have an existing attachment and you wish to recategorize it, three-dot icon next to it, edit. That lets you change the category. So for instance, I'm going to change this as here to an attachment. The nice thing about this then, it comes up in the paperclip icon, which I like to normally say is an uncategorized section. You can see here, it also displays with a paperclip. As you may know, in addition to the core offerings of Genie or Gen 2, there are optional additions that some practices use to help get these tasks done more effectively and efficiently. By partnering with select companies who provide these products, we can integrate them into Genie and Gen 2 and provide even better solutions. Solutions that connect directly into practices' workflows, making their lives easier. If you have any interest about any of the products we have on display, I ask that you get in touch with our sales team. We'd be happy to discuss them with you further. I will now hand it back to Michele.
Thanks, Sean. I hope everyone picked up a few new tips or tricks there in Genie or Gen 2. Genie is one of those products that no one will ever know absolutely everything that's possible in Genie. So we like to keep surfacing up some of those for you. Right, now you've heard a little about voice, and I'm sure most of you are familiar with Dragon or DMO, Dragon Medical One. These are products, the underlying product is from Nuance, but we're really pleased to have integrated that into Gen 2. and Dragon is still standalone in Genie, but you can also use it DMO in Gen 2. For those of you that aren't using a dictation product in your practice, maybe your doctors would like to, we're really pleased we've been able to negotiate with Nuance a 30-day free trial. They don't normally do this, but we're really pleased to be able to offer that to you. So obligation-free, 30-day free trial. If you like it, you can continue. If it doesn't work, there's no obligation to continue. So after this, an email will go out to you with some information on how to access that free trial if you're interested. So this is just one example of how we are endeavouring to share information with you ongoing. We do have the free lunch and learns. These are announced through emails. I hope that you're aware of them. The next one for Genie next month is on Eclipse and Medicare, and in Gen 2 it's about improving the prescription experience on the back of the recent release of EPrescribing. Please sign up for those webinars. Even if you can't make the webinar, you will be sent a recorded link so that you or members of your practice can watch that after the case. This webinar will also be circulated as a link, so anyone in your practice that hasn't been able to join today will be able to watch the recording. We continue to offer face-to-face group training. We thought that, this might diminish the interest in this post-COVID, but it's back thick and fast. Practice staff particularly like coming together face-to-face on these full-day trainings. So it's a different topic every month. At this stage, it's still only on Genie, but we are exploring offering some Gen 2 training in this format as well. The next one in August is on billing and quoting. Billing, very challenging for many practices. And so this will be a popular course, and that's available in Brisbane, Melbourne, Sydney and Perth. So please sign up for that. We also, obviously, our support desk, most of you are familiar, I'm sure, with the 1300 number. We're endeavouring to find more and more ways for you to get in touch with us to make that a streamlined process. Our phone lines are open 7:30 to 7 for Genie and 7:30 to 6 Gen 2 Eastern time. But if you need to call outside those hours, or you do call at a time that for whatever reason there's a wait, often it's related to our staff being off sick and things like that that are out of our control, we have introduced live chat. Live chat is live with a person, not a bot. So I do encourage you to give it a go, particularly helpful if you've got a waiting room full of patients and you just need a quick answer to something rather than getting on the phone. Please do live chat our really experienced staff. They're responding there for you. Also, the knowledge base. We have 2 dedicated staff that all they're doing is constantly updating our knowledge base content. So we do want you to be able to search and find answers for yourself at any time of the day. If your question or inquiry is not urgent, we do encourage you to send an email or submit a ticket through the knowledge base, and someone will reply to you in that way, just to save you getting on the phone.